When we think of nursing, we often visualize these quiet, intimate moments of care, like a precise adjustment to a monitor in a pediatric ICU. Public perception often frames this as a supportive role, localized to a single room, and physically constrained to the patient immediately at hand. This hands-on care is vital, yet it represents a fraction of the profession's actual reach. Think of the bedside as the center of an expanding radius. From the individual patient, nursing influence scales outward to guide entire healthcare systems. To see how modern medicine functions, we have to look past the hospital bed. Focusing only on the bedside ignores the reality that nurses are the core infrastructure driving global healthcare. Even within the hospital, the work moves rapidly into high-acuity environments like trauma bays and operation theaters. In these spaces, nurses exercise advanced clinical autonomy, making rapid, independent calculations and executing life-saving interventions in seconds. Whether in a maternity ward or the ICU, they manage complex medical technologies while simultaneously interpreting volatile shifts in a patient's condition. These professionals function as the primary clinical engine, ensuring patient survival. Beyond the hospital walls, the radius of care expands into society. Nurses lead public health campaigns and manage rural outreach initiatives where resources are scarce. Embedded within schools and homes, they act as preventative health strategists, identifying risks before they become emergencies. In mental health and rehabilitation settings, they map out long-term recovery, guiding entire populations towards sustained wellness. By treating health crises at their local roots, community-embedded nursing prevents the systemic collapse of our medical centers. At the physical limits of the profession, military nurses and disaster response teams deploy into highly volatile environments. When traditional infrastructure fails, these teams rely on logistical adaptability and triage mastery to establish order and save lives. The radius also extends into the digital frontier. Through telehealth and remote monitoring, physical distance no longer limits a nurse's expertise. A single practitioner can evaluate symptoms and manage data for patients across massive geographic spans almost instantaneously. Whether in a physical disaster zone or connected via satellite, this expertise operates unbound by geography. This vast scope is built on a rigorous educational continuum, starting with foundational degrees and scaling through advanced university science. This progression builds specialized capability, allowing nurse practitioners to exercise diagnostic authority. At the peak, PhD researchers and clinical scientists design protocols the industry follows. This clinical background also drives executive leadership. Nurses now steer global health organizations and direct hospital networks from the boardroom. Through scientific training and continuous education, these professionals act as the architects of our future healthcare system. Whether analyzing global health data or holding a patient's hand, the foundational mission remains identical. This fusion of human compassion and scientific innovation defines the profession. Nurses act as the vanguard, pushing medical advancement forward. Nursing is not just a profession. Rather, it is a limitless journey of care,